Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for tuning in to this very quick, short procedure of a procedure I performed in a patient with a narrow and twisted ear canal. This is the patient's left ear, and the earwax is fully obliterating the ear canal from the entrance all the way to the eardrum. There's a lot of skin adhesions that's attached and enveloped itself around this plug of wax. The ear canal is quite narrow. You can actually be aware of that just by comparing the size of the Zollner suction probe into the ear. So this is a standard Zollner suction probe, and it's almost filling up the entire ear canal, especially near the entrance, and there's quite a prominent bend. You can see this is the first bend of the ear canal where I'm just mopping up, and this is the second bend. So there's quite a bendy ear as well, but it just shows you the benefits of an endoscope when removing earwax. We've got the whole field of view. We can visualise the entire ear canal. So just a bit of dead skin, and this skin has attached itself to the isthmus region. So around 0.5 centimetre away from the eardrum, the ear canal narrows and it protrudes back outwards. It creates an inferior recess, so a trench at the base of the ear canal near the eardrum, and what we call an anterior recess. So a little cravat on the left-hand side of the ear canal near the eardrum, in the case of the left ear. If it's the right ear, the anterior recess will be on the right-hand side. So just some dead skin wax on the posterior lateral canal wall, so near the entrance. None of this wax that's left behind is going to cause the patient any problems, but just using a fine end gauge here, just to gently suction it. It's near the entrance. I'm just going to mop up now. So again, just going back in, there's a rainy bit of wax on the posterior canal wall. Because it's a bit wet, it's easy to suction. We're just hovering over it. So this is some dry skin. You can see this is near the entrance. You can just see some of the hair strands there. So we know on the outer third. You see how the ear canal inclines. Again, some soft wax near the entrance. We're going to remove that in a moment. Just a mopping up procedure now. This is a good image of how bendy the ear canal is. You can see it deviates to the right, almost at, I wouldn't say quite a 45-degree angle, more 30 degrees, and then it then straightens. So past the second bend, the ear canal straightens itself. So hope you enjoyed that video, guys, and you've learned a bit more about the ear anatomy and the bends that we have. Take care.